Madam President, Americans might have noticed a trend in Obamacare headlines over the past 2 days. There was Sunday's Politico story, and it basically had this title: "Why Liberals Are Abandoning the Obamacare Employer Mandate." And there was an Associated Press story entitled, "Senate Democrats Try to Pull Focus from Obamacare." Then on Monday, Politico published a story called "Obamacare's Next Threat, a September Surprise," which is about the White House's efforts to prepare Democrats to meet September rate hike announcements. Madam President, all of these stories amount to one thing: Democrats are running scared from Obamacare. These 3 articles are just a few of the many pieces to be published about Democrats' efforts to distance themselves from Obamacare in preparation for the November election. And Madam President, it's not surprising that they're worried. Obamacare is Democrats and the White House's main legislative achievement, and Americans don't like it. They didn't like it in 2010 when the law was passed. They didn't like it when the law was being implemented, and they don't like it now. A Quinnipiac poll from last week reported that 55% of Americans oppose Obamacare. Similar numbers of Americans opposed it 3 months earlier, and almost 3 months before that. In fact, Madam President, when you average polling on the health care law from late 2009 until today, you find that the health care law has consistently been opposed by the majority of Americans. Opposition to the health care law currently averages nearly 14 percentage points higher than support. That's not a good sign for Democrats. Many Democrats who firmly supported the health care law in 2009 and 2010 believed that that law would grow more popular when the American people found out what was in the bill and how it would benefit them. But the health care law has not gotten more popular. Americans found out what was in the bill, and they didn't like it. And Democrats are realizing that their support for the bill may cost them their seats in November. And so now they're running in the opposite direction. According to Monday's Politico article, the White House knows very well that Democrats are finding Obamacare to be a big problem in their campaigns. So it has redirected the efforts of its Obamacare war room to preparing for the release of rate hikes that are coming in September. The White House and its allies know, and this is a quote from the story, they've been beaten in every previous round of Obamacare messaging, never more devastatingly than in 2010. And the story goes on to say, and they know the results this November could hinge in large part on whether that happens again. So they're trying to avoid, or at least get ahead of, any September surprise, end quote. That's from the Politico story. Well, Madam President, let me just say to the White House, good luck with that. There's a reason why the White House and its allies have been, as Politico notes, beaten in every previous round of Obamacare messaging. It's because the White House's messaging didn't match up with the reality that it promised Americans. The White House can talk all it wants about Obamacare's supposed benefits, but if Americans aren't experiencing those benefits, no amount of talking is going to work. And most Americans aren't experiencing Obamacare benefits. They're experiencing Obamacare pain, higher premiums, higher deductibles, the loss of doctors and hospitals, less control and less freedom. Like most members of Congress, I've gotten countless letters from constituents telling me about the pain Obamacare is causing them. Tom in Hurley, South Dakota, wrote to me to tell me his premiums have more than doubled and his deductible has quadrupled since the President's health care law was enacted. Harvey from Mitchell, South Dakota, wrote to tell me that his insurance went up 16% effective April 1st of this year. Biggest increase ever, he said. Jill from Sturgis, South Dakota, wrote to tell me that she went online to get a health care insurance estimate at healthcare.gov and found that the cheapest plan would cost her $366 a month and a $5,000 deductible. Are you kidding me? She wrote. That's $9,392 a year I have to pay in every year before it even pays anything, which is roughly 16% of our combined income. I can't afford that and try to save money for retirement at the same time, she says. Madam President, Jill's not alone in not being able to afford that. Too many Americans are in similar situations, facing the prospect of huge health care bills and wondering how on earth they're going to pay them. All the talk in the world from the White House isn't going to make people enthusiastic about Obamacare if they can't afford their Obamacare premiums or have lost access to the doctor or the hospital that they liked. Madam President, Politico reports that 21 states have posted preliminary health insurance premiums for 2015, and that average preliminary premiums went up in all 21 states. Those proposed increases, several in the double digits, are coming on top of the steep premium hikes many Americans faced this year. The White House can attempt to defend these increases as much as it wants, but there really isn't any way to spin huge premium hikes when you promise people that their premiums not only wouldn't increase, but would actually go down. Madam President, Obamacare is fundamentally broken. This bill was supposed to reduce health care premiums and lower the cost of care while allowing Americans to keep the doctors that they liked. Instead, it's done the exact opposite. And Obamacare isn't just driving up health care premiums, it's also devastating our already damaged economy. The Obamacare 30-hour work week rule is forcing businesses large and small to reduce employees' hours at a time when many Americans are struggling to find full-time work. USA Today reported yesterday that Friday's unemployment report found a sharp rise in the number of part-time workers who prefer full-time jobs. So what you have, Madam President, is people who want to work. They want to work full-time, but full-time jobs aren't available, so they're taking part-time work. Why? Well, one of the reasons that they attribute is the Obamacare requirement that the work week be a 30-hour week as opposed to a 40-hour week. And so what's happening is employers are hiring employees for less than 30 hours a week so they won't be stuck with all the requirements and the mandates that come with Obamacare. And so it's leading to more part-time jobs when people actually are looking for full-time work in our economy. The law's burdensome mandates and regulations are placing a heavy burden on small businesses and making it impossible for many of them to expand and to hire new employees. And as Politico reported, when it comes to the employer mandate, even liberals are admitting that the rule is unnecessary and burdensome. Politico notes, and I quote, "The shift among liberal policy experts and advocates has been rapid. A stream of studies and statements have deemed the mandate only moderately useful for getting more people covered into Obamacare, and they too have come to see it as clumsy, a regulatory and financial burden that creates as many problems as it solves," end quote. That's from the Political story talking about many of the liberal policy experts who are now turning their back on the employer mandate. And then there's the potential for fraud, with the Health and Human Services Inspector General's office reporting that the administration is not properly verifying that those receiving subsidies actually qualify for them. And the disastrous websites have cost taxpayers hundreds of millions of dollars. Madam President, the list just goes on and on and on. Whether they admit it or not, everyone knows that Obamacare isn't working. It's time to start over and to replace this law with real reforms. Reforms that will actually lower costs and improve access to care. Republicans have offered solution after solution to solve the many problems created by Obamacare. From Senator Collins' bill to repeal Obamacare's 30-hour work week, which I just mentioned earlier, to a provision that I came up with that would exempt schools, colleges, and universities from Obamacare's crippling employer mandate, something that our colleges and universities across the country are feeling, and it's impacting their ability to hire employees. Instead of fleeing from Obamacare or attempting to put a positive spin on its many failures, Madam President, Democrats should join Republicans to repeal this broken law and replace it with real reforms. Then the Democrats would have a real accomplishment to take home to their constituents. And they wouldn't have to worry about having the White House send a team of people in the war room assigned to Democrats here on Capitol Hill who are trying to figure out ways to message the bad news that keeps coming out about higher premiums, higher copays, higher deductibles, fewer doctors, and fewer hospitals. That is the message that Democrats here in Congress are having to deal with when they respond to the constituents that they hear from in their districts or their states. And that's why the White House is so focused on changing the subject from anything to anything from Obamacare. Madam President, that is the reality, and it's an economic reality that is affecting and impacting way too many American families. Middle-income families in this country are squeezed. Household income's gone down by $3,500 since the President took office. Everything Americans, middle-income Americans, have to pay for has gone up, from health care to college education to fuel, electricity, food, you name it. And so those middle-income families in this country are increasingly feeling squeezed and pinched by this economy, made much, much worse by the passage of a health care law that has driven up the cost of health care, higher premiums, fewer doctors, fewer hospitals, fewer full-time jobs, or part-time jobs. Why? Because employers are trying to avoid the heavy-handed mandates and requirements to provide government-approved insurance. And so they're finding more and more part-time employees when the employees, people out there in the workforce, are looking for full-time jobs so they can provide for their families, good-paying jobs with opportunities for advancement. That's where we ought to be focused. And unfortunately, everything coming out of Washington, D.C., and particularly the policies coming out of this administration, namely, first and foremost, Obamacare, is making it more expensive and more difficult for employers to hire. It's costing middle-income families more to cover their families with health coverage, and it's making everything else in our economy more expensive. Madam President, that's the reality that most Americans are dealing with. We could do so much better. We should do so much better. And if Democrats will acknowledge the error of their ways in the passage of this bad law to start with, we can go back to the drawing board and do this in a way that actually does reduce costs and provide better access to health care for American families. Madam President, I yield the floor.